All right, so I'm going to introduce our first presenter today. We have Amanda Lawler. She is the founder and president for Bat World Sanctuary. Today's topic is welfare and permanent population management. Go ahead and take it away, Amanda.
Bat World Sanctuary is the only bat sanctuary accredited with the Global Federation of Animal Sanctuaries, and GFAS is the only globally recognized organization providing standards for identifying legitimate animal sanctuaries legitimate animal sanctuaries. Being an accredited sanctuary is a rigorous process that includes regular inspections of husbandry, financial data, record-keeping policies, programs, safety for both animals and staff interviews, and much more. One of the goals of GFAS is to differentiate a verified or accredited sanctuary from a pseudo sanctuary. While both GFAS and AZA have animal welfare standards in place, GFAS goes a bit farther with these four main points. GFAS believes that a sanctuary or rescue center's acquisition of animals should be legal and ethical in the animal's best interests and not done in a manner that encourages the commercial trade of animals. Euthanasia. GFAS believes that humane euthanasia of an animal is an acceptable final option when all other options to relieve pain and suffering have been addressed. It is not to be used as a management tool to create space for animals, but is a decision governed by an ethical, humane euthanasia policy developed by the sanctuary. Breeding. GFAS believes that a true sanctuary, including those that rehabilitate animals for eventual release or adoption, does not engage in intentional breeding of animals in captivity, with limited exceptions. Public tours. GFAS does not require sanctuaries or rescue centers to offer tours or other public visitation programs. Tours may be acceptable under GFAS standards if the visits are guided, educational in nature, and meet other criteria that promote that promote and protect animal welfare and safety. For the purpose of this presentation, I will be talking about common species of fruit bats, as for the most part, they are ungoverned. Insectivorous bats, however, are governed at both the state and federal level. It is unlawful to keep them as pets. The problem of fruit bats entering the cruel exotic pet trade began when the CDC deregulated the permitting process for owning bats in 2001. The previous permitting process made it difficult to own a bat, thereby discouraging the exotic pet trade dealers and the like. Once the permitting process was eliminated, fruit bats began to enter the pet trade, where unscrupulous animal dealers bred them to sell their offspring for outrageous amounts. Some of these dealers even operate under the guise of conservation or call themselves a sanctuary. While some of these bats were likely imported into the US, many came from zoos, where overpopulation of bats caused issues and seemingly drastic measures were taken. Baby fruit bats are always in high demand and are oftentimes ripped from their mothers before they are entirely weaned. Egyptian fruit bats in particular form strong bonds with their offspring, and when permitted, will cluster with mom for life. I've seen this personally after rescuing pregnant Egyptian fruit bats, and following their behavior over the years with their offspring. When small pups are ripped from their mothers and sold, they are often fed substandard diets that result in calcium deficiencies, including a loss of teeth and metabolic bone disease. All bats entering the exotic pet trade experience terror, inappropriate and damaging nutrition, and when sold alone, terrible loneliness and boredom. It is not unusual for a bat sold as a pet for $2,500 to be dead within a year of purchase. Our first chance of rescuing short-tailed fruit bats destined for the pet trade came the same year, in 2001, when a zoo closed in Northwest Florida. To my knowledge, this zoo was not AZA accredited. When they closed, they had an excess of 400 short-tailed fruit bats that they needed to dispose of. These bats were housed in an enclosure that measured 10 feet by 10 feet. While they likely contacted other zoos and some bats were probably placed, a large number of them ended up in the pet trade. I was alerted to this when a UPS driver called us from Florida. He was making a delivery to the zoo, and some of the keepers asked him if he would like some bats. He was shocked at the offer and declined. The driver was actually a Bat World follower and immediately contacted us. When we contacted the zoo and offered to take 50 of the bats, when the bats arrived, there was a packaging slip on the side of the shipping container. That slip was actually meant for an exotic pet store, not Bat World. It was apparent that whoever was shipping the bats mixed up the packing slips, and our slip was likely on the container that was shipped to the pet store. I immediately contacted our USDA officer who investigated the pet store, only to find out that most of these bats had already been sold to the public. Later, we found out that some of these bats had made their way into a reptile expo and they were being sold for $25 each. The witness who called us said the bats were being packaged up in styrofoam soup cups with lids, and they were even being sold to children. The primary cause of fruit bats entering the pet trade is overpopulation, and the primary cause of overpopulation is simply not neutering male fruit bats. Most bats on display are kept in smaller enclosures for public viewing, and if the population becomes out of control, overcrowding leading to aborted fetuses, abandoned pups, and juvenile deaths and feeding frenzies will occur. All of the above can be stopped by simply neutering the males. The fruit bat species that are entering the pet trade are those that are most common in zoos, which include short-tailed fruit bats, Jamaican fruit bats, and Egyptian fruit bats. In this 4-foot wide by 10-foot long filthy enclosure, there were over 60 bats, 18 Egyptian fruit bats, and 42 short-tailed fruit bats. A rescuer came across the sale ad and went to view these bats and then discovered these appalling conditions. The floor was covered in pine shavings along with thousands of roaches. As you can see, the bats were fed on the floor and received nothing but apple slices. Their food dish was covered in feces as well as roaches. These photos were taken by Bat World staff when we went to rescue the bats. Many of the bats were pregnant and were placed in quarantine until their pups were born. Males that were born were neutered when they came of age. This photo is of an African fruit bat that was supplied by a keeper. The lone bat was purchased from a dealer to be placed on display. Judging from his discolored wing membranes, he has obvious nutritional deficiencies and appears to be painfully thin. These photos of fruit bats in what are essentially roadside zoos were supplied to us from concerned citizens. While we're not sure where these bats were procured for the exhibits, we can only imagine that having bats in the pet trade made their availability much easier. Aside from the filth and lack of fresh food and water, there's no way for these bats to climb up to the ceiling if they happen to fall. The photo on the right, you can see an Egyptian fruit bat attempting to drink water, but the level of water is too low to come out of the nozzle, as seen by the green arrow. I would like to now share with you a small sample of our rescue stories. The following photos are bats that were purchased from the pet trade, either for pets or for exhibit. Sully, seen here, was purchased by a couple along with another Egyptian fruit bat. At some point, the boyfriend left, leaving the bats behind with his girlfriend. Over time, one of the bats escaped a bird cage they were housed in and was chased and killed by the family cat, leaving Sully alone. It was then that the girlfriend contacted us and Sully was rescued. When he arrived, he was placed in our quarantine enclosure with a neutered male for company. After he was neutered and healed, he was allowed to join the general population in our large flight enclosure. On the second photo, you can see him marked with a green ear so we could monitor him as he settled in. Isis came to us after she'd been on display along with her roost mate for several years at a Six Flags amusement park. At some point, the male died. It was explained to us that when we were contacted that all of Isis's babies had also died while on exhibit. She was sent to us a few months after her partner died. Rocky came to us after he was purchased as a pet, and his owner let him fly through the living room where he crashed into a kitchen table and broke his jaw. When we received him, he was suffering from obvious nutritional deficiencies as well as being injured. The after picture shows Rocky about 6 months after recovery at Bat World Sanctuary. Stella was rescued after she and her mother were purchased as pets and kept in a cage in the owner's living room. The owner of the bats died in his apartment, and the bats were then discovered. They were initially sent to an animal shelter where a rat broke into the cage and ate the mother bat. Stella broke her leg during the attack and it healed backwards. Stella was finally transferred to us, and she absolutely thrived during the last few years of her life. In 2022, we were alerted of a cruelty seizure that happened in Norman, Oklahoma by a facility owned by a veterinarian. Egyptian fruit bats were among the numerous exotic animals of all sizes on the property. All of the animals were in terrible condition and starving. The photo on the right shows one of the males being released into our flight enclosure after he healed from being neutered. Just last month, we received a message from a vet tech who wanted to place an Egyptian fruit bat. The bat came to the clinic in terrible shape. The owner of the bat had originally purchased 4 Egyptian fruit bats from an exotic pet trade dealer and had then gone on vacation. The owner hired someone to come in and care for the bats while he was gone, but that person never showed up. 3 of the bats slowly starved, and 1 lone male was the only survivor. In this video, he was being cared for by the vet tech who rescued him and is placing him with us. Even though he's being cared for as well as possible under the circumstances, you can see how desperate he is to fly. He is headed to us this week, and after he's neutered, he will be able to fly to his heart's content in our indoor semi-outdoor flight enclosure. We often reach out to people who have fruit bats and as pets and offer a safe and friendly rescue for their bats if they ever decide to give them up. We also offer all travel expenses as well. In cases where owners are adamant about never relinquishing their bats, we offer to send enrichment items. It is our hope to make the quality of life for the bat in their care somewhat better. Some of these pet bat owners accept our offer and some do not. This photo shows the enclosure of a pet bat owner we communicated with to better the care of the bats in her possession. She eventually moved them from a bird cage to this slightly larger enclosure and added a few items of enrichment. In 2015, after much discussion over the years with the AZA Bat Tag, which is a bat taxon advisory group, regarding bats entering the pet trade through AZA zoos, the Bat Tag created the following position statement. The Bat Tag supports the elimination of the trade in pet bats for the following reasons. 1, pet bats pose a risk to public health and safety through communicable diseases such as rabies, histoplasmosis, Nipah, Hendra, Ebola, and Marburg, and injuries sustained during handling and sudden unpredictable episodes of aggressive behavior. 2, elimination of the trade in pet bats aids enforcement of legislation that prohibits private ownership of these bats as regulated by individual states. 3, pet bats are often maintained in inadequate housing and without consideration for their social and psychological needs. 4, there is an adverse impact on wild populations through the smuggling and import of bats, which ultimately end up in the pet trade. And 5, pet bats are unable to contribute genetically to those conservation programs in which they are needed due to their isolation from managed population, and also in many cases to serious deficits in their social skills related to the rearing and maintenance in isolation from others of their kind. The position statement goes on to say, it is the consensus of AZA's Bat Tag that education about bats and legislation to restrict the trade in bats as pets are likely to be the most effective means of curbing this trade, and the following actions will be necessary for AZA institutions to effect an impact on the trade. 1, manage zoo collections to control breeding and eliminate the sale, trade, or other disposition of zoo bats to individuals or animal dealers known to place bats with individuals. 2, recruit educators to develop and produce materials for zoo visitors and potential bat buyers. 3, align with other groups, including regional bat working groups, animal advocacy groups where appropriate, bat rehabilitators, and local and legislative bodies to influence and enact legislation needed to restrict the trade in pet bats. And 4, investigate existing regulations in place state by state relating to privately owned bats. Universities and institutions permitted to hold bats must become responsible for bat welfare, including uncontrolled breeding. Research protocols clearly separate breeding activities from experimental activities and the Office of Lab Animal Welfare and the Animal Welfare Act require separate protocols and approvals for breeding. Researchers who routinely overproduce offspring should have their breeding privileges revoked by the Institutional Animal Care and Use Committee. These universities must also declare to the CDC the end result of the bats in their research projects. And then the principal investigator must clearly define both experimental and humane endpoints for the study before seeking approval for the project. Most universities lack the funding and space to keep bats long enough to find proper placement, so they are euthanized. A non-lethal means of placing research retired bats must be found, such as an accredited sanctuary or a licensed bat rehabilitation center, and a project budget should be allocated for continued care by the receiving facilities. Zoos must also become more responsible for uncontrolled breeding. Currently, zoos are not required to have breeding plans in place, often relying instead on the notion that the public loves to see babies as justification for uncontrolled breeding. The AZA Animal Care Guidelines, section 7.5, titled Contraception, states, many animals cared for by AZA accredited institutions breed so successfully that contraception techniques are implemented to ensure that population remains a healthy size. Then, in the bullet point list of population control measures, culling is described. However, culling does not solve the problem. The AZA and USDA must require that all species in such facilities be managed with documented breeding plans or contraception measures such as neutering the males or separating the sexes to prevent overpopulation. When humane euthanasia is performed, it should result in a rapid loss of consciousness, followed by cardiac or respiratory arrest and subsequent loss of brain function. The euthanasia process should minimize or eliminate pain and distress prior to loss of consciousness. The use of isoflurane, an inhalant anesthetic, has been used humanely on both fruit and insect-eating bats. While there are drugs that can humanely induce unconsciousness in fruit bats prior to being euthanized by other methods, we feel there is no acceptable method other than the use of isoflurane inhalant to euthanize insectivorous bats. The AVMA panel on euthanasia suggests that cervical dislocation, decapitation, and CO2 on small mammals. And being small mammals, insectivorous bats unfortunately fit into this category. However, we find that cervical dislocation is not an acceptable method of euthanasia for bats, as they are anatomically different from other mammals. It takes expert hands to master the technical skills to ensure the loss of consciousness is rapidly induced, and even then, there is evidence that this method may not cause immediate unconsciousness. We also feel that decapitation is an unacceptable form of euthanasia for bats, as it has been demonstrated that electrical activity in the brain persists for 11 to 14 seconds after the head is removed. In addition, the simple act of decapitation is likely highly distressing to the bat as well as the person performing the act. Along with caring for the well-being of bats, zoos and universities must also care for the well-being of staff and students. The use of CO2 on insectivorous bats is inhumane, as they have a high tolerance to CO2. It takes several minutes for bats to suffocate using this method, and it is extremely painful and distressing. We have reached out to the AVMA on numerous occasions over the last 2 decades, encouraging them to list bats in a special category that eliminates the use of CO2 for euthanasia. Sadly, as of the latest 2020 AVMA guidelines, bats have yet to be given this special consideration. How do we stop this? It's tricky. Stopping reproduction in a large population of fruit bats is not as easy as simply separating the sexes, but that's where it has to start. 3 enclosures outside of general population will be needed. 1 for male bats to be neutered and allowed to heal, 1 for female bats that are not showing signs of pregnancy, and 1 for female bats who are obviously pregnant or have a pup clinging to them. It is very easy to tell when a female fruit bat is heavily pregnant, as her abdomen will become quite large, much like humans, and it will feel firm under gentle pressure. All of the enclosure should be large enough to enable flight, as well as containing ample enrichment. The next step is neutering the males. Once they are healed, they can be returned to their original flight enclosure or general population. Pregnant bats that give birth are monitored in 2 ways. If a pregnant bat gives birth to a female, she can return to general population. If she gives birth to a male, both mom and pup must remain in the designated enclosure until the pup is old enough to be neutered, and after he heals, both mom and her boy can return to general population. The females, who may or may not be pregnant, must remain in a separate enclosure until their gestation period has well passed, or an ultrasound can be performed assuring she is not pregnant. Once she has been determined to not be with pup, she can be returned to general population. Mothers who are indeed pregnant and give birth to boys will remain in the enclosure until their pups are old enough to be neutered, and again, once healed, can join general population. Now comes the tricky part. Carolia, or short-tailed fruit bats, have delayed fertilization up to a year, which means keeping the I'm not sure females quarantined for a year, and if possible, a few months more in order to be absolutely sure. Egyptian fruit bat pups can be easily sexed at birth. That's when the testes can clearly be seen under the skin as the pup has not grown fur. The other time they can be easily sexed is when the testes descend, at which time it could be too late and may have already impregnated a female. During the time in between these 2 points, you are basically looking at the photo to the right. It's near impossible to tell the sex. My suggestion is to sex an Egyptian fruit bat immediately after birth and move mom and pup to the designated enclosure to await neutering. But if all else fails, and an Egyptian fruit bat male is accidentally released into general population as a baby, you will eventually hear him singing to females when he becomes of breeding age. These bats sound like puppies whining, and can be caught fairly easily when their sole attention is on the female they are singing to. If a male is discovered, then it is important to note the gestation period and monitor all of the bats closely to see if any pregnancies developed, at which time you have the absolute joy of starting this entire process all over again. But there is a bright side. African and Jamaican fruit bats are exceptionally easy when it comes to stopping reproduction. In both of these species, it's easy to tell the pup is a male, and they can be neutered at a few weeks old while still being cared for by mom. After they are neutered, they can be immediately returned to mom while healing, all while remaining in general population. I would like to point out a couple of things before playing this video. As a sanctuary, we are equipped for procedures. Our wonderful veterinarian of 30 years does our neuters on site. Our technique is aseptic, and everyone involved scrubs up. Ideally, everyone would also wear gloves, although you will see this is not the case in this first video. We have performed over 100 successful neuters of all species of fruit bats with 0 complications. We choose to neuter rather than vasectomize, as vasectomies in bats have been known to reverse. We also do not spay because of the invasiveness, the pain, and the low survival rate. Meloxicam should always be provided before neutering. The procedure you will see in this video is the same for African fruit bats. For smaller species, such as Carolia, Artebius, etc., the spermatic cord can be torn rather than tied off with a suture and then removed. The incision can be closed with surgical glue, as seen in this video. Also, with smaller species such as Carolia, the assistant may need to help by pushing the testicle forward with an index finger to enable the initial incision. Gloves should be worn for this method. Gravity may also be needed to accomplish this by tilting the head upwards, higher than the pelvis, while the bat is anesthetized, and then using the index finger to push the testicle forward and holding it in place so the incision can be made. Bats are held in quarantine flight enclosure and monitored until they are healed, which usually takes a week or 2. It's important to monitor the bats during the healing process in order to spot any complications that may arise and begin antibiotics if needed.
So typically we keep them at a fairly light plane of anesthesia. I do 1 surgical scrub and then do an open castration technique. And for bigger bats, or bats of this size, I use a single ligature around the spermatic cord.
He's starting to go. There we are. There we are.
Compared to dogs and cats, we have to be able to, the person running the anesthesia has to be able to react much faster than we would on a dog or a cat, as far as the plane of anesthesia is concerned.
Okay, he's still pretty light, so I'm going to go up to 3 on him. Okay, one of the things that's critical to watch is his respiration. He should be breathing down low on either side of his pelvis, right about where Dr. Jarrett's fingers are. If his breathing slows down too much or moves up into his chest, then immediately take him off of isoflurane. Hold him upside down because that does help the respiration. Open his mouth, try to get him to breathe a little bit better. And then as soon as his breathing is returned to normal, you can put him back under ISO.
So I'm going to strip some of the connective tissue, the tunics from the testicle. While we're doing the procedure, it is impossible to maintain a completely sterile technique. But the instruments are autoclaved prior.
I'm going to move this away from him just for a second.
Yep.
It looks pretty deep.
His eyes are starting to open.
Okay, thanks. We noticed his little eyes and ears wiggling, so I'm putting the cone back over him. And I'm still watching his respiration, which is steady and down low where it should be. Right now he's on 1.5 because he was pretty deep at 3, so I scooted it down to 1.5.
Do something. Add some weight here. Dropping everything.
Okay, little one. He's starting to come out, so I'm gonna work a little quicker. Sorry, little one, but I'd rather have you awake. I know, darling. I know.
Can we get it a little? No, it's good. It's good.
Is it? Okay,
Yeah.
good.
Yep, it did good.
All right, good boy. Yeah, good boy. Good boy. The only difference on doing him and, say, a Corollia would be that you don't tie the cord.
Correct.
So. It's all right, baby. Let's wake up. Wake up, dog. He's gripping, which is good. You always want to make sure they grip. If they go under too far and you're having a hard time waking him up, then stretch the wing out. This is a sensitive area. You can kind of tickle this area. You can open their mouth, stick your finger in, wiggle their tongue. There are a lot of things you can do to try to stimulate them to get them to wake up, as well as just giving pure oxygen if needed. But he's coming out of it just fine. He's still shaking a little bit, so we're going to let him get a little bit more rested, and then put him back into the quarantine enclosure for about a week. Let him heal really well, make sure he's doing well, and then he'll be, both of these little guys will go back into the general population. There you go, doll. There you go. Good boy. You're all right. You need to grip. You're okay, darling. You're okay. You're okay.
There are already some regulations in place on helping or stopping this. The Department of Natural Resources and Fish and Game already regulate native and non-native animal possession, and USDA also regulates mammals in trade. So it appears that we have regulations in place that discourage bats from entering the pet trade, but those regulations are not actively enforced. We need stricter guidelines to manage zoological populations, including the approval of all dispositions. Many zoos have short-tailed fruit bats numbering in the hundreds due to careless and uncontrolled breeding. It has been stated they have no place to separate the sexes. However, these same zoos have the funds for other projects that apparently take priority. Bats must become a priority in these zoos. Updating USDA standards for keeping fruit bats in captivity would go a long way toward eliminating fruit bats in the exotic pet trade. This would include mandatory flight enclosures that are large enough to provide continuous flight, adequate enrichment, hiding areas, and a variety of fresh fruit provided daily. Most breeders, as well as potential pet owners, will be unwilling to go to these lengths and will forgo dealing in bats. Lastly, we need the possession of fruit bats to be covered by the CDC as done previously. There also needs to be permitting in place for both the transport and transfer of fruit bats within the U.S. In closing, I would like to personally thank Dr. Martha Keller and Dr. Lori Gage for creating this critical symposium on bat welfare. I sincerely hope that this is just the beginning of much needed changes to better the lives of captive bats in areas where it's most needed. Thank you so much for attending, and I look forward to your questions.
Okay, thanks, Amanda. We do have a few questions. First one, do bats have a tendency to inbreed?
Not that we have noticed. We did a behavioral study back in the early 90s with free-tailed bats, and it involved a reproduction study, and we did not notice any inbreeding. That was something we were careful to watch. We did not notice any inbreeding in the captive colony.
Okay, thank you. Next question, why do you feel isoflurane is the only acceptable method of euthanasia?
Well, for insectivorous bats, it is the only method that doesn't cause stress, that follows the guidelines of basically loss of consciousness before death. Any other method that we have seen does not, it just doesn't seem humane. It causes stress, it causes pain, and it's not an acceptable method. Euthanasia, bats, insectivorous bats in particular, succumb to euthanasia fairly quickly, just go to sleep. We put them in a closed container with an airtight lid once they have lost consciousness, and then that lid is not opened until death has occurred. And it's a very, very humane method of euthanasia for insectivorous bats.
Okay, thank you. If bats are being tested for rabies, we are unclear on whether they are infected with rabies. How does one safely euthanize a bat in a humane way to minimize the risk of being bitten?
Well, ideally, if the bat is exhibiting the signs of rabies, then you would be wearing gloves first. You would be careful not to be bitten. You'd also use a cloth if needed, and again, put the bat in a soft cloth or a fabric pouch or something, and place that bat into a chamber that would be airtight. So, I mean, there's not going to be a risk if you're taking all the proper precautions by using gloves and a cloth and a closed container to euthanize.
Okay, thank you. What do you do for pain management after this medical procedure?
We actually administer meloxicam prior to any medical procedure. We also use other tramadol when it's needed, but Medicam is our primary form of pain management.
In castration, what is used to close the wound?
We use there are different products, different surgical glues. Our preference is Gluture. That seems to be the best one to work for skin on bats in particular.
Okay, thank you. Have you needed to use an e-collar post neutering?
We have not ever had to do that. We have seen it used on some of the bigger bats, but all of the bats that we have neutered have just left themselves alone, left the area alone after they've been neutered. So we've never had that issue.
Okay, thank you. How long is a safe amount of time to assume a bat does not have rabies, to add it to the group, etc.?
And we're talking insectivorous bats, I assume, are native bats. If the bat, there's more than one answer to that. If the bat comes in by itself, then we usually isolate that bat for about a week or so. Hopefully he can be released in a couple of days. But most colonial bats do better when they're housed together. So we do want to house them together as soon as possible. If bats come in together, then they're housed together. But as far as the acceptable time length, insectivorous bats, their incubation period varies it could be several weeks, it could be months. So what we do is vaccinate all of the insectivorous bats on entry and then house them together. And that way it eases stress, and it's better better to manage the population that way. Of course, if a bat is exhibiting the signs of rabies when he comes in, that bat's never put with another bat. So, because rabies does cause bats to be grounded, and of course we watch for all the signs. I've been working with bats for 30 years and pretty much know what rabies looks like, but like the back of my hand. So it's easy to tell if they're even showing the slightest sign. And those bats, of course, are not placed with other bats. We wait to see if more signs present themselves, and then that bat would be humanely euthanized.
Okay, thank you. Next question. Do you not worry about bleeding with having meloxicam on board prior to surgery?
We have never had an issue with meloxicam and excessive bleeding in any of the bats that we've neutered. So it's not been a concern.
How do you handle public rabies paranoia caused by misinformation from authorities or uninformed rehabbers?
Well, the step is as education. I always try to approach it on the level that I used to believe when I first started. And, I was brought up to believe all bats had rabies. And when I rescued the first bat, Little Sunshine in 1988, even though I rescued her, I was still afraid of her. And I even had nightmares about the bat being in the house with me. So I understand how these people feel, especially when a lot of misinformation has been put out by the media. And so I always try to approach it on a compassionate level and let these people know that, yeah, we understand how you feel, but here's the truth. Here are the actual facts. And we provide our website and other websites, as well as the CDC website, that give them the information that they need to make an informed decision on everything.
Okay, thank you, Amanda. And I think we're going to cut the questions right there. Really appreciate this presentation. If you have questions specifically for Amanda, you can address those directly with her using the Whova app. We're going to take a break and we'll be back at the top of the hour for the next presentation.